Welcome to my channel. Don't forget to like, comment and subscribe.
The pathophysiology of diabetes leading to gum disease or periodontal disease is complex and involves a multifactorial interplay between the host's immune response, microbial environment, and systemic conditions associated with diabetes. Here's an in-depth explanation based on authentic scientific references. Elevated blood sugar levels can have several detrimental effects on the tissues surrounding the teeth. Hyperglycemia leads to the non-enzymatic glycation of proteins, resulting in the formation of advanced glycation end products, or AGEs. AGEs accumulate in various tissues, including the periodontal tissues, and can modify the structure and function of proteins, such as collagen, in the gingiva. These modified proteins can trigger inflammatory responses and impair normal tissue repair and regeneration processes. Increased inflammatory response. Hyperglycemia enhances the expression of inflammatory cytokines such as interleukin-1b, tumor necrosis factor alpha, and interleukin-6 in the gingival tissues. This cytokine release leads to increased inflammation, which can promote periodontal tissue destruction. Immune dysfunction. Diabetes affects the host immune response, compromising the ability to fight off infections, including those in the gums. Neutrophil dysfunction. In individuals with diabetes, neutrophils, a type of white blood cell that is crucial for fighting infections, show impaired chemotaxis, adherence, and phagocytosis. This dysfunction makes the gums more susceptible to bacterial invasion and subsequent infection, contributing to periodontal disease. Altered antibody production. Diabetes can also alter the production of antibodies, which are critical for neutralizing pathogens. This altered immune response may reduce the effectiveness of the host's ability to combat oral bacteria, leading to an increased risk of periodontal disease. Microvascular changes and reduced blood supply. Diabetes can cause changes in the microvasculature, the small blood vessels that supply nutrients and oxygen to the tissues. Thickening of blood vessels. Chronic hyperglycemia can lead to thickening of the basement membrane in small blood vessels, including those that supply the gums. This thickening can reduce blood flow and oxygen supply to the gingival tissues, impairing their ability to heal and defend against infection. Reduced healing capacity. The impaired blood supply caused by microvascular changes means that periodontal tissues receive less oxygen and fewer nutrients, which are essential for repair and regeneration. This reduced healing capacity makes the gums more vulnerable to bacterial infections and slows recovery from periodontal disease. The oral cavity is home to a variety of microorganisms, forming a biofilm on the surface of the teeth and gums. In people with diabetes, high blood sugar levels can alter the composition of saliva and gingival crevicular fluid, providing a nutrient-rich environment that supports the growth of pathogenic bacteria such as and which are strongly associated with periodontal disease. The increased glucose levels in the oral fluids of diabetics can enhance bacterial adhesion and colonization, leading to an increased risk of infections and a higher likelihood of developing gingivitis and periodontitis. Alright, so let's talk about the role of advanced glycation end products, or AGEs, and their interaction with receptors known as RAGE. AGEs interact with their receptors on the surfaces of various cells, including those in the gingiva. The binding of AGEs to RAGE can activate pro-inflammatory pathways, leading to the production of more cytokines and reactive oxygen species, or ROS. This interaction exacerbates the inflammatory response and promotes tissue destruction in the gums. Moving on to oxidative stress. Hyperglycemia or high blood sugar is associated with increased production of reactive oxygen species. These ROS can damage cellular components like DNA, proteins, and lipids, leading to cell dysfunction and death. In the context of the gums, oxidative stress can exacerbate inflammation and contribute to the progression of periodontal disease. Now, Let's discuss the bidirectional relationship between diabetes and periodontal disease. It's also important to note that periodontal disease itself can worsen glycemic control. The systemic inflammation caused by periodontitis can lead to increased insulin resistance, making it harder for people with diabetes to manage their blood sugar levels effectively. This creates a vicious cycle where diabetes and periodontal disease exacerbate each other. In conclusion, the pathophysiology of diabetes leading to gum disease involves multiple mechanisms, including chronic hyperglycemia, immune dysfunction, microvascular changes, enhanced bacterial growth, increased inflammation, and oxidative stress. Understanding these mechanisms is crucial for managing both diabetes and periodontal health effectively.
Thanks for watching.